session. Be sure to visit our YouTube channel. Every session is recorded and uploaded to our YouTube channel. Thank you for subscribing. I think we're up to like 618 individuals. So that's very significant for a center of our nature. So with that, I think we have about 100 individuals on. We're going to turn it over to John. Remember, go at your own pace. John goes slow, he goes fast, but we need you moving, okay? So with that, be sure to get a sturdy chair, anything that you can use to exert activity. We'd love for you to participate. Take it away, John.
Hey, I want to say welcome to the Emory Alzheimer's Disease Research Center. Today, I have my ankle weights. I have my arm weights. What I'm going to do first is show you some exercises you can do to rehab and making sure your knees okay, keeping those quads strong, keeping those hips strong, and keeping that upper body tone. So before we get into our cardio and plus abs, we're going to do some little techniques you can do. All right, here we go. And if you don't have your ankle weights, you can use your own body weight. So the front of the quads, lift your knee up and press. We're just going to do only 6 reps. And good. Next one, sit it up. Squeeze the quad. Even if you don't have ankle weights, there you go, come on. And 6. The next one, so we can get the outer quad, turn your toe in, and then press forward, and you feel that outer quad engaging. 4, 5, and 6. All right, other leg, turn that toe in, turn that hip, and go. 1, 2. For body sculpting and also making sure you get those quads nice and firm and strong. And good. For the inner quads, turn your toe out and press. Good inner thighs, good inner quads. And you remember, squeeze. 1 more, and good. Turn the toe out, inner quad, and go. There you go. Turn that toe out. Squeeze. 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 And squeeze. Good. Now we're going to work on that hip. I just want you to roll that hip. For that hip flexor, you're getting a good stretch. Plus they're getting strong at the same time. And it's attached to them lower abs. There you go. Other leg, let's go. Circles. Nice form. Nice form. And good. All right, our next one, I want you to get your legs straight. Reach out in front. And we're going to, you're getting that high quad plus them lower abs. And good. Next arm, ready, and let's go. 4, 5, and 6. Good. Next one, I'm going to turn my toe out, and I'm going to bring it in and out. In, elongated, and bring it in. You're getting those hip flexors. You're getting those lower abs. There we go. Keep it going. And good. Next side. And let's go. There you go. Nice form. Nice form. And good. There you go. Okay, our next one. What we're going to do is, I'm going to just extend, move out, bring it in and out. So I'm going to do a combo. Quads, hip flexors, outer hips, inner thighs. You ready? Out, in, bring it back. Out, outward, Bring it in, down, outward. There you go. Come on. And good. Here go the next one. Here we go. Nice form. Be almost graceful. That's it. Good quads, good outer hips, good inner thighs. One more. And good. Some good simple techniques you can do for those quads to make sure you can't do all your rehab on the knees. Strengthen those quads that's going to support those knees and take a lot of pressure off your knees if you're having knee problems. Also, it increase you so you can be able to walk faster, do your exercises more effectively, and be under control and balance. And working those hip flexors, inner thighs, and being complete. Some simple exercises you can do with your ankle weights or some kind of band. All right, but we're going to get ready to get this upper body in. Here we go. I already have my ankle weights on my wrist. If you have dumbbells, canned goods, bands, here we go. Let's go. There we go. I done made it out the land of the rain. I can tell you, shake my hand that it's ain't. Free the guys who once never made a stage. Nothing with a check, I made it home safe. Baseball numbers on all of my contracts. Getting the birthday, all of my contacts. Break it down, break it down, break it down, break it down. Make 20 million. Back it up. Trying to run it back. Press. Let's go. It goes down on the way, they gon' press. Gotta leave my soul on my cash. I know it don't last. I'm rocking these tracks. I went through a lot. This money is fresh. 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 Money is fresh. Hey. I get a lot to get here. No limit. I put a lot in my ass. Both on the right as fast as you can. Hold on. I gotta take off that way. I don't wanna be with you. My business is to be praised. And even if it's heavy, I talk to him daily. I told him he's not coming home. I just hope he don't think I'm just serious. But money keeps coming. I'm feeling it great. I can't actually detach it on no session day. I was trying to see what it takes. Let's go. 60 the feelings amazing. Now I can charge about an hour or 60 minutes. Said it gave me a minute. That's crazy. My diamonds really be down and no shade. I'm going out and no shopping, okay?
Life is over like a car.
Rest.
And you learn again so you can say amen. We will change for you. We will change for you.
Boom. Let's rock. Let's rock. I heard that waistline in here. Come on.
I like them with fake prophecies.
Come on.
I hate it when you get on top.
Come on.
Magazines on the legacies.
Come on.
Tell me how much it costs.
Come on.
100 milliliters stretch for me.
Come on.
I can stay
Bring
in
it,
track and
press.
start.
Watch it.
Odds can't
Watch it.
buy
Let's go.
boxes. If you ain't down, you an enemy. I got followers that are kill for me. And they lining up like a DMV with the finest girls that you ever
Let's
seen.
go.
From California, she's sober like Diet Coke with the diet. She
Let's go.
on my face, on my stash. Watch you.
Come on now. Get them hands up. Get them 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 up.
Talking guns on roads, it ain't Coachella. I'm a good fella, I'm a good fella. Johnny them with up, I'm a good fella. I'm in paradise. But these small titles got me terrified. I'm so terrified. Life is more in the face of God. We still walking with the cameras on. She a fairy tale, she a superstar. Even down to the way that she breaking hearts.
Come on.
She ain't acting, I'm not an actor. Cause reality is what I'm after. Real emotions, I'm trying to capture. So it's all like a
Great job. Woo. Now we're going to get that upper body. I need you on your toes. Here we go. On your toes.
Wanna see it on the tippy toes. Wanna see it on the tippy toes. Wanna see it on the tippy toes. Wanna see it on the tippy toes. Tippy toes. Tippy toes. Tippy.
Get on them toes.
Tippy toes. Grind around, 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 grind around. Tippy toes. Tippy toes. Tippy toes. Tippy toes. Tippy
We getting that cardio in. Let's go. Let's go. Let's go.
Tippy toe, she lit. 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 Tippy toe,
Great job. Great job. Oh, y'all working today. Y'all working today.
I was born by the river in a little tent.
There we go.
Oh, just like
I need that waistline now.
I've been running ever since. It's been a long,
Come on now.
a long time coming, but I know change gon' come. Oh, yes, you will. It's been too hard living, but I am afraid to die, 'cause I don't know what's up there beyond the sky. It's been a long,
Come on now. Give me that waistline.
a long time coming, but I know change gon' come. Oh, yes, it will.
Come on now. There we go.
There's been times that I thought I wouldn't last for long, but somehow I think I'm able to carry on. It's been a long time coming, but I know a change don't come. Oh, yes, it will.
Come on now.
Then I go to my mother. I said, Mother, could you help me, please? Help me, help me.
There we go.
She
We
said,
get a
I've
good
been
stretch.
trying
Plus to get that waistline now. Stay with me.
I'm just not able. And then I looked around, and I was right back down.
Come on.
Down on my knees. Oh, there's been times that I thought I would last for long.
Come on now.
But somehow I think I'm able to carry on. It's been a long time coming, but I know a change will come. Oh, yes, it will.
I want to say thank you, thank you, thank you. And I want to say congratulations for doing something special for your temple today. I'm John Lewis, and see you later. Bye.
Excellent, excellent, excellent. Thank you, John. Thank you, everyone, for getting active and moving. All right. Well, without further ado, I would like to introduce to some and present to others Dr. Monica Parker. She's an associate professor here in the Goizetta Alzheimer's Disease Research Center, and she's the director of our Outreach Recruitment and Engagement Core here at Emory. Welcome, Dr. Parker.
Thank you, Mrs. Dorbin. Thank you, Cornelia, Crystal, and John. It's our pleasure today to bring to you Ms. Rashia Sherman, who is an audiologist who's going to talk to us a little bit about hearing loss. If you've been paying attention to our programs, you know that the Lancet Commission report cites hearing loss as a risk factor for developing Alzheimer's and related dementias. So what people may not understand is there are different types of hearing loss, and different types of hearing loss are managed differently, just like dementia is. So today, we're going to hear from Rashia Sherman, who is a hearing instrument specialist. So she's going to talk to us a little bit about hearing aids, what they are not. She has over 20 years of experience in the field of audiology. She is a graduate of Florida A&M University in Tallahassee, a renowned university, a historically Black college or university renowned for their scientific research and enterprise. So at this time, Ms. Sherman, it's your show. You're on mute.
Thank you. Got it. Wonderful. Thank you, Dr. Parker. Thank you, everybody. Let me get here just one moment. All right. So as Dr. Parker said, my name is Rashia Sherman. I am the owner of Georgia's Premier Hearing Solutions. And today I'm going to share with you some effects of untreated hearing loss and just taking a look as a whole of what untreated hearing loss can do to your brain as well as other parts of your body. So we want to look at it as a whole and just kind of see what other things are going on with your hearing loss. All right, so this is just a picture of people that are socializing. What I notice is that when people first come to me, one of the first things or first signs of not being able to hear is being in a crowd situation, a social situation where you're not able to understand what people are saying. So this may be your graduation of your grandchildren or a funeral or church meeting. It may even be just being out at a restaurant or simply watching your favorite TV show. But just experiencing times where you're hearing people talking, you may not be understanding everything that's being said. You may be having trouble following along in the conversation. And at times this can be very frustrating, not only to the individual, but also to the people who you may be speaking to, who may have to repeat themselves, or that may be speaking to you and you may not be responding. So we want to make sure that we're present in these special moments and just showing how not being able to participate or not being as present as you would like to be or normally be can affect your life as a whole.
Excuse me, Ms. Sherman, is there supposed to be something on the screen? There's a white screen showing.
There should be something on the screen. Let's see here. Let's go to the second slide.
Do you know hearing?
Okay, perfect. There we go. All right, and then can we go to the next slide, please? So while we're doing that, I just want to talk about some of the things that can cause the relationship between cognitive decline and hearing loss. I think we're still working on this. Okay, perfect. So this is just a slide to show you about the relationship between cognitive decline and hearing loss. I have so many people that come into my office and they say to me that they never knew that hearing has anything to do with your brain. And so I do want to talk to you about the relationship. I also want to talk to you about some of the negative effects of an untreated hearing loss. So as we age, one of the things that starts to happen is that many of us can develop a hearing loss. A hearing loss is permanent, it's progressive, and it's irreversible. The way that we actually hear and our brain is able to process information, or the way that we hear is our brain is processing that information. And so that's important to think about when you do think about your hearing, is that it's not just that you're hearing sounds, it's also your brain's ability to process the sounds and words that you hear. when you have a hearing loss, one of the things that starts to happen subsequently is that the brain starts to become unable to process words the same way that it did. You may find that you're starting to put forth a lot of listening effort in order to understand what people are saying in those situations. Just like I mentioned before, it could be simply in the house when someone's at a distance from you, or when you're in background noise. And these times your brain is putting forth so much listening effort that it can actually cause cognitive load. When this happens, this can cause anxiety, irritability, frustration. It can make you feel much more tired than you should because your brain is just overworking itself. And what we have to remember about the brain is that it is a muscle, so it has to receive the proper stimulation. When you have a hearing loss, naturally, the auditory portion of the brain is not receiving the proper stimulation, and it starts to atrophy or deteriorate, which then causes the brain to become unable to process words. So the change in the brain structure that occurs actually is when people are talking to you, you can hear sounds, but your brain is not processing those words properly. This damage to the brain is also permanent. So this is something that can happen to you when you don't treat a hearing loss. Sometimes I have patients that wait so long that by the time that they do decide to get hearing aids, their brain is not processing words in the way that it should. And so they're hearing a lot of sounds and not able to understand words as well as they would like to. So that's why we definitely encourage that we get tested and that we also treat hearing loss when it's present, and to act immediately. Instead of being reactive, be proactive. Another thing that can happen is that we have reduced activity and isolation, because now I'm at church, I couldn't understand anything anybody said, or I went to an event and I'm so embarrassed that I've had to say, "What did you say? What did you say?" That now I'm just nodding. I don't know what was said. And I didn't enjoy myself, and I don't want to put myself back into that situation again. So now I'm going to isolate. So can we go to the next slide, please? Perfect. So now let's talk a little bit more about cognitive decline. I know this is a word that we may kind of throw around sometimes. I want to just explain it in a more simple way. And this is really about the way that your brain is processing and how it's working. So it has everything to do with the way that you think, the way that you reason, the way that you may remember. And with hearing loss, it's how can you expect yourself to remember something that you never heard? So a lot of times I talk to my patients about hearing loss mimicking some of the pre-dementia signs, such as somebody told me something today and I don't even remember. Well, if I give you 5 things and you only heard 3, you're never going to remember the 5. So that's a part of it. Another thing is just being aware. So a lot of times when you have hearing loss in situations where there's a lot of things going on, words and sounds in the background can bleed together. And so now we just aren't understanding the way that we should. And so cognitive decline is something that with people that have hearing loss, this starts to happen at a much quicker rate. So this is definitely something we want to pay attention to, because we want to take care of our brain. And if you do treat hearing loss, it can start to rejuvenate the stimulation to the brain so that we can slow down the atrophy and that we can slow down the deterioration of the hearing loss. Can we go to the next slide, please? All right, so our next slide is about depression. So what tends to happen, like I was saying, is that people stop doing some of the things that they love. And that's what's heartbreaking about this. Hearing loss is something that actually will start to separate you from your friends, your family, places that you love to go, and things that you love to do. As we get older, it's so important for you to, just like John was saying, stay active and make sure that you do the things that you love to do. So if that may be playing a bridge game with friends, if that is going to church and being in fellowship, whatever that may be, you want to make sure that you're able to do it and that a hearing loss isn't withholding you from doing that, because it can cause depression, isolation, and social withdrawal. So what we have found, studies have found, is that people who have hearing loss are more likely to experience social isolation and depression. So this is something that not only affects your hearing, it's something that actually affects your mental health. So we want to make sure that we don't allow a grandmother or a parent that we see at events that we notice that they're not following in conversation, and someone who may normally be a very talkative person, we notice that they're kind of off into their own world. These are signs many times that someone may be experiencing some type of hearing loss. Can we go to the next slide, please? Another thing that can start to happen is that we're more at risk for falling. I cannot tell you how many people that we talk about in my office that may say to me that they accidentally had a situation where they tripped over something or they happened to fall. And what I want you to know is that the balance nerve is actually in the ears. So, and this all is connected with the brain. So when you have a hearing loss, your equilibrium is off. So you're going to experience situations where you may be off balance. Some people have dizziness issues. So treating a hearing loss can also help with balance issues. Now, by no means am I saying that if you treat your hearing loss that you're not going to have some unbalanced episodes. But what I am saying is that when you do have a hearing loss present that goes untreated, that it can perpetuate many situations like this with risk of falling. So this is something that you definitely want to take care of. So we find that with falling, that as we get older, the muscles and the bones are not as strong as they used to be. And some of these falls can be pretty serious. So like we see here, every 11 seconds, an older adult is seen in an emergency department for a fall-related injury. 28 to 35% of people age 65 and over fall every year. So we know that as we age, we want to start taking care of ourselves better and being more aware of some of the things that can happen. So what I want you to take away from this is that it's not just about your hearing. What it's about is your overall health. And we definitely want you to look at the entire picture. So when you have someone that's saying, oh, I'm just not hearing, or that's okay, people can talk louder, it's not just that, it's the functionality of the brain. It's the state of your emotional health. And also we have some balance issues. These are some other things that we notice that are very common in people that have hearing loss: obesity, diabetes, tinnitus or tinnitus. You have safety and balance issues, hypertension, autotoxicity, loneliness, dementia, and Alzheimer's. So these are all things that we all want to watch out for as we get older, and we want to make sure that we take care of these things. So I wanted to show you that hearing loss doesn't just affect the way that you're hearing people. It affects your mental state, your emotional state, your physical state. So this, as an overall health concern, is something that we need to really take care of. So for every 20 people that have hearing loss, 2 have depression, 4 are lonely, 8 have high blood pressure, and 15 will have a future fall. So these are just some of the statistics to know, so that you understand that it's not just your hearing that we're dealing with. We're dealing with the brain. We're also wanting to remember that this is permanent and it's progressive. And unfortunately, with hearing loss, it's not something that you can get back. So we want to make sure that we pay attention to that. At the end of the day, the most important thing to take away from this discussion is understanding that wearing hearing aids ultimately is going to reduce the risk of cognitive decline that's associated with hearing loss. It will also help with some of the other things that you may be dealing with that we mentioned before. One of the things that I also mentioned to my patients is to remember that the brain controls the whole central nervous system. So that's why we have some of these things that are causing anxiety, irritability, frustration. And so these are a lot of internal things that sometimes, because the hearing loss is so gradual, these are things that sometimes we get used to dealing with and we're just dealing with it. But when you can do something simple to resolve an issue, it's best to take care of it instead of just to let it go. So I definitely would encourage everyone to do these 3 things. So these are things that you can do to make a difference today. I would encourage everyone to get their hearing tested. That's the first step. Just get it tested. Just see if there's a hearing loss that's present. That does not mean that you have to get a hearing aid. That does not mean that your life has to change, because I know that there is a negative stigma about hearing aids. And what I'd like to do is crush that stigma, because at this point, hearing aids are very small, they're very unnoticeable, and a lot of people have them on and you just might not even notice. But for just a small device, it does so much to improve your quality of life, because that's what we're talking about. At this point in time, we know that as we get older, we want to cherish the moments that we have with the people that we love. And this is something, like I said before, that really it separates you from the things and the people and the places that you love to go. Number 2 is treat your hearing loss by wearing a hearing aid. So with this, my recommendation is definitely going to a professional, healthcare professional, because this is a very individualized thing with hearing loss and hearing aids. You don't know what is best for me or what do I need to do. So go to your audiologist, your ear, nose, and throat specialist, your hearing instrument specialist to get your hearing tested. Have someone to go over the hearing loss with you and explain to you what your particular hearing loss is. No 2 hearing losses are the same. I have a lot of times patients will say, well, my neighbor has this type of hearing aid. And I'll say to them, well, there's a lot of things we don't know about your neighbor. Like, we don't know what degree your neighbor's hearing loss is. So their hearing loss may be severe. Yours may be moderate to severe, or it may be mild to moderate. If that's the case, you will not be recommended the same device as someone else. This definitely is something that is individualized as far as your personal hearing loss, your personal listening style, and your lifestyle. So someone may be very active and a style may be more appropriate for their lifestyle, and somebody else, a different style may be more appropriate for their lifestyle. So I would recommend that you go to a professional so that you can make sure that you're given a recommendation that's going to work best for you based on your hearing loss. And also with hearing loss, the most important thing is how well your brain processes information once you do get enough volume. So because the hearing loss is progressive, one of the things that can start to happen, like I mentioned, is that the brain will start to process words differently. So when someone's talking, if you've ever noticed when you're talking to someone who may have a hearing loss, they may not understand everything that you're saying. And with that being the case, they may need something different. Like, you may need better sound quality, better background noise reduction. And these are all things that professionals like myself myself specialize in the devices. We specialize in understanding how to treat these hearing losses and helping you to get the best benefit out of wearing your hearing aids. So I encourage everyone to treat your hearing loss by wearing hearing aids. I have people ask me all the time, well, hey, do you think I can get a cochlear implant? What I do want you to know, because that's not my scope of practice, but I do want you to know that a cochlear implant is not like a cosmetic surgery or something that you just can walk in and choose to do. It's something that is very, it's for a special type of hearing loss. And there's a lot of factors that go into qualifying for that type of surgery. It's very intense. And so really the easiest thing to solve and to treat a hearing loss is to simply wear a hearing aid. Your professional will tell you what would be the best recommended device for your hearing loss, for the way that your brain processes, your lifestyle, and things that you like to do to make it essentially effortless. I will not lie to you and say that treating hearing loss is not a process, because it is. It took some time for you to lose the hearing. And so a lot of times we gradually need to add it back so that your brain can acclimate to hearing all the new sounds and to the new sound and feel of your hearing aids, because it is something different that you have to start wearing and putting to your daily routine. I have patients that say to me all the time about when we're aging. So now you have a cane and now you have this and now you have that. And so, the hearing aid is something in addition to that, but I want you to start to look at it as something that will help you to exercise your brain and also to slow down the deterioration of the atrophy of the auditory portion of your brain. And it's also going to slow down the lack of hearing as well. So it's all great things, in getting a hearing aid. Last, I encourage everyone to act fast. If you go and you get your hearing tested and they tell you that you have a hearing loss, don't wait until it's gotten so bad that all of these things have started to happen in your life and then you're finally getting a hearing aid, because once what you don't use is going to be gone. So if you don't use it, you lose it. So that's very important. All right, that's the end of my presentation. I'm opening it up for any questions that anybody may have about anything that I said, but I definitely encourage everyone to share this information with anyone that you feel may be suffering from or experiencing some of these things. And the first step is just simply going to get your hearing tested. And from there, the professional that you go to will give you a great recommendation and guide you through it. And we walk with you hand in hand through this process of learning to hear again. It's exciting.
So thank you, Ms. Sherman. That was an excellent presentation. So well delivered, and you're so cheerful talking about something so important, so serious. Can you
Absolutely.
tell people the differences between, let's say, sensory neural hearing loss versus conductive hearing loss? I mean, I'm a clinician, so I'm aware of those things. And
Absolutely.
which one is more likely to be helped by the hearing aid? If you have sensory neural hearing loss, that's not going to be helped by a hearing aid.
Well, actually, sensory neural hearing loss is what most of my patients have, because that is the type of hearing loss that you're going to have from aging. So that's the most common hearing loss that someone is going to have, that is going to be a perfect candidate for wearing a hearing aid. However, if you have a conductive hearing loss, which means that you have an issue in the middle ear that may require a surgery, or you may need to get some type of medication, or there may need to be something further done, then that's when you would most likely see an ear, nose, and throat specialist. And that specialist may then give you medication. They may put a tube in your ear, but there is possibility that you have a conductive or mixed loss, but you still also have a permanent hearing loss that's present. So I do have several patients that, let's say that you have a hole in your eardrum because of something that happened in the past, but you also have a permanent hearing loss. So you may be seeing an ear, nose, and throat specialist who may recommend a surgery to repair the eardrum, but you also may be recommended to wear hearing aids as well. So that can be a very common situation. Or you may be someone who has had like a stapedectomy or mastoid issue. And for the people who understand what I'm talking about are people who have possibly gone through this, that you also still may need a hearing aid. So I hope that that answered the question. As far as most people, the hearing loss that is associated mainly with aging is going to be sensorineural hearing loss. Hearing loss that is conductive, a lot of times that means that you need to see an ear, nose, and throat specialist. A conductive loss many times is not permanent. So there's many things that can be done, like a medication that can be taken or some resolution to help the hearing be restored if the hearing has been affected. A mixed loss is when we're going to have a sensorineural hearing loss and also a conductive loss present. And so the person may need some type of medication in addition to wearing hearing aids. So these two things can all go together at the same time. So I've seen many people who have both and still need hearing aids. That's why I definitely recommend that you see a professional in that case.
So for a cochlear implant, that would be for somebody who has a conductive hearing loss, problems with their middle ear.
So I don't want to, because that's not my scope of practice. I don't know the specifics of when a person will qualify for a cochlear implant. But what I can tell you is this, is that when you go to get your hearing tested, I don't believe that it's based off of necessarily the type of hearing loss, but it has a lot to do with the severity of the loss that you may have. So sometimes there may be someone who has a sensorineural hearing loss that is very severe, and they may be very young. And so the best solution for them may be to get a cochlear implant. But this is a very intense surgery where a hole is put into the skull, and then there's a device. The devices are smaller and it's not as intense as it used to be, but it's not something that you just walk in and get one, or that even you may want to experience, especially as you get older, to go into a operation of that magnitude. But you would be referred to, so the first person you would go to would be an ear, nose, and throat specialist. And from there, he would refer you based on what his thoughts would be. So the professional would need to qualify you for that type of surgery.
And an ear, nose, and throat surgery would be something covered by one's insurance.
Usually it would be covered by one's insurance.
Okay. Now,
but that again may be something that is going to depend, when you on your insurance or what have you.
Because that's a big question in the chat. I'm going to let you look there.
Okay.
One of the questions is, does hearing loss affect your sense of direction? Equilibrium you went into well, but does it affect your sense of direction?
Absolutely, it can. So sometimes because when we hear a sound on the left side versus the right side, we know which way to look. So definitely hearing loss can affect your directionality, because let's say that you have no hearing in your left ear and you only hear out of your right ear, then that's a person that is not going to have good directionality, because we only have one ear that can hear. So if you have a hearing loss that there's possibly one ear that's better than the other, you may be able to hear sounds from one side better than you're able to hear sound from another side. So yes, hearing loss definitely can affect directionality. because especially if you can't hear in both ears. I mean, because now the sound is muffled and it causes a lot of confusion. So yes, absolutely. Do you want me to start going through some of the questions here I see?
Q&A, and there's some in chats too. I've just been trying to pick up on the ones that seem to be recurrent. Insurance and hearing aids is a big one, but go on and start with Ms. Gillis's question. We answered one of them, but go on. You see in Q&A?
Okay,
I'll read hers to you.
I see. Okay, got it.
Is tinnitus, and there's a couple of questions in chat and in Q&A about tinnitus. Is tinnitus hearing loss, prelude to hearing loss? Can you explain tinnitus, which we call ear ringing, and hearing? Yes. What's the relationship?
Okay, that is I want to tell you guys, everybody, I want to say most people come to get their hearing tested because they're hearing some type of noise. And it does not have to be a ringing. It can be an ocean sound. It can be a cricket. It can be, I mean, I've heard so many things. So yes, tinnitus is usually the root cause of tinnitus is going to be a hearing loss. So if you're someone who has experienced consistent ringing, consistent whatever sound that you're hearing for years, usually that is a a telltale sign that yes, this person most likely will have hearing loss. However, I do want to say to you that there are some very special cases where someone may have TMJ that can then cause TMJ. So this is something with the jaw that you can experience pain. And a lot of times people think it's something that's going on with their ears, but it's actually that you may grind your jaw in your sleep. And so you're having ear pain, you go to the ear, nose, and throat doctor. And then what we find is that in fact, there's not anything going on with the hearing, but that you're having pain that's maybe in the lower part of your jaw, or can even be a little bit seemingly behind the ear, that has nothing to do with your hearing, but that it can seem like something's happening, but it can cause that ringing. Also, we're in Atlanta, allergies, sinus issues can cause tinnitus as well. So one of the key things is if it's something that is constant and ongoing, usually that is definitely going to be hearing related. If it's something that's seasonal or inconsistent or fluctuating, that's something that you definitely, either way, this is something that you want to go in, get tested, because there's tests that we can do to see if this is hearing related, if it's sinus related, if it's something that has to do with TMJ, or what have you. But this is definitely one of the most common things that people want to know. What I will say to you is, unfortunately, there is no cure for tinnitus. I've heard people tell me that they've taken special pills, they've changed their diet, they have gotten acupuncture, they've gotten shock waves sent through their tongue. There's nothing that's clinically proven to get rid of tinnitus. So it is something that's permanent. A way that you can kind of ward against having those sounds is by blocking the sounds that you're hearing with sound. So ambient noises, a fan, ocean sound, rain sound, those are things that you can do to help with that. So a lot of people are very disappointed when they go to a professional and we don't spend a lot of time on it. The reason why we don't spend a lot of time on it is because there really isn't a whole lot that we can do about it. So I hope that answers the question.
Thank you. There is one here that I think is a good one, and this may follow up with some of that cochlear implant. It says, can hearing aids be implanted? This is from Mr. Jerry Darian. Can hearing aids be implanted? And there are some ads that look like hearing aids are being implanted. Can you talk about that?
So I don't know if I would say implant, but what I can say is that there are hearing aids, for example, like a lyric. And this is something that is put inside of the ear canal. So this is a hearing device that's put inside of the ear canal that is not seen at all. So it's invisible in the ear canal. And that's something that you would go to a professional, and they would put the device inside of the ear canal, and you would go every so often to get it taken out and put back in. So yes, there are hearing devices that can be put into the ear canal that you cannot see. There are also hearing devices that you can take out of your ear every night that are virtually invisible as well. And so these are called invisible in the canal hearing aids, that can be very, very, very small, that you would take out every night and put back in every day, that are not behind the ear. So some people do prefer something that is in the ear versus behind the ear. So they're different styles. So there is something that can be implanted that you don't take off every day. And then there's something that you can get custom made for your ear canal that would fit your ear canal perfectly, that could not be seen at all, that doesn't go behind the ear, that goes inside of the ear canal, that you would remove every night and put back in. So I hope that answers that question there.
That's a good one. Okay, so this one is from Mars. I can't really feed the last one. It says, what kind of hearing loss happens after being subjected to very loud music? And this is a good question for those of us who are parents and grandparents whose children put earbuds. Can you get hearing loss from just earbuds in your ear?
You know, I will say this. I have some very young patients that I noticed that I have some very young patients. So we definitely want to watch the use of the earbuds. I would not encourage sleeping in earbuds or wearing them for really extended amounts of time, because sometimes we can experience a sudden hearing loss. And I want to touch on that. But, you know, the type of hearing loss that and there's two things that can happen. So there can be a noise induced hearing loss, or there can be hearing loss that you have been noise exposure, like you've been exposed to noise exposure over a period of time that causes hearing loss. Or for example, you go hunting with your friends and you're not wearing ear protection, and a loud sound goes off and you have sudden hearing loss. In those cases, I want to be very clear with everyone. Do not wait until you feel like your hearing is going to come back. You need to see a professional right away if you experience sudden hearing loss. This happens a lot with younger people, and this happens a lot. You know, if you take a flight and you get to a certain altitude and all of a sudden your hearing is gone, when you get back on the ground, if you haven't gotten your hearing back in a few hours, I would definitely recommend going ahead and scheduling an appointment with your ear, nose, and throat specialist, because there's only a certain window of time that you have that's less than a week or within a week that you can go to a professional. They may prescribe to you, which you would go to an ear, nose, and throat specialist, and they may prescribe to you a steroid to help to restore the hearing. If you wait until after that time, then you could be stuck with a permanent hearing loss. That happens all the time. So there are different types of hearing losses that you can have based on the type of noise exposure that you've had. So if it's sudden hearing loss that's due to a sound that was heard, that's one thing. If it's noise exposure over a long period of time, usually that is still going to be sensorineural hearing loss. It just may have a noise notch, or it may just have been caused because of the exposure to noise over a period of time.
So within 5 days of a loud noise exposure, like somebody shot a gun off and your ear was right next to it.
Yes.
See your ear, nose, and throat doctor to make sure you don't have permanent damage.
Absolutely. If you feel that you have had sudden hearing loss, if you feel that your hearing loss has all of a sudden changed drastically, or even if it's not, if you notice a change in your hearing that has happened suddenly, I recommend that you call your ear, nose, and throat specialist immediately and get in to see them. And if they can't get to see you for weeks, call someone else, because so many times I'll have people that say they went on a flight, the fireworks went off, they were by a speaker and something happened, and they were waiting for their hearing to restore. And 2 months later, now they're here at the ENT and there's nothing that can be done, even though we may still, steroids may still be prescribed. The longer you wait, the more less likely it is that we can regain the hearing. So that's very important.
Okay. Well, I'm going to say thank you very much to Ms. Sherman for this lovely presentation, and everybody seems to have enjoyed it. We're going to have you back.
I would love to come back. I know that there's a lot of questions.
Yeah. I do see where we have Megan Nare for a cognitive empowerment program coming on next. I'm going to let Megan tell you who's going to be following with the cognitive empowerment program. Ms. Sherman, thank you so much for coming. And I think you had a slide up there with your contact information. If not, we'll put it in the chat.
Thank you.
You can put it in the chat.
Okay. All right.
And then Dr. Parker, before Megan gets off, we want to talk about next Tuesday.
Oh, my last little blurb before Megan gets going. We have our Lakembe Town Hall featuring Dr. Eric Johnson on August 29th here at the Brain Health Center. If you're available to come in person, please come in person. If not, you can join us by Zoom like you are today. We're having a very special town hall about the new Alzheimer's drug Lakembe. So hope to see you there. There's the information about registration. Ms. Dorbin, call Ms. Dorbin, 404-712-1416, or email us the way you normally do if you want to be in person on site with us. Okay, Megan?
Thank you, Dr. Parker. I'm just jumping on to invite everybody to join us for our programming that follows BrainTalk Live. We do CEP Community Live every single week, and it's a really supportive space that offers educational videos, discussions, workouts for those with early stage memory loss, also known as mild cognitive impairment. And this week we have a 45-minute accessible workout with Mark, one of our physical activity trainers, that you can do from home. So feel free to join us. The link is posted into the chat for anybody who would like to register, and we'll continue to send those weekly email reminders once you do register. Thank you, Dr. Parker.
You're welcome. Thank you all for joining us. We'll see you next week at our Lakembe Town Hall. Thank you.